The main thing's getting recognition for our kids that get injured in this country, and they're an incredibly vulnerable group, and to be able to get recognition for this catastrophic problem that we have is quite important, because kids' injury is actually the leading cause of death and disability in Australia in children, and it causes more hospitalisations than double that of kids with respiratory disease, cardiovascular disease and diabetes combined. So I just really want to raise community awareness. I run a paediatric critical injury research program, and what we're trying to do is address the three major gaps that we're aware of. And the first one is to work out where injury is actually happening in Australia, and not only where but why and how and for what kids, so that we can do something about it that's evidence-based. And the second thing is, if a child is critically injured, what can we do to make sure they get the care they need in a timely fashion so that they have the best opportunity for a high functioning outcome. And the third area is what we can do to support parents, because at the moment we don't really know what parents need to help them get through this life-changing event. And if parents don't cope well, we know that children don't cope well. And about 50% of parents get PTSD, and we need to intervene early for that. Pretty devastating, especially for me as a parent and as a parent that lives in a regional part of Australia. We've found that childhood injury rates haven't changed over the past 10 years, and that's despite having various injury prevention programs out there. And in fact, deaths from injury in children have increased over the past 10 years. We also found that if you are injured in a rural or regional area, you are more likely to die from your injuries if you're a child. And that has been highlighted again by the systems work that we did, looking at how a kid gets from that injury site to the hospital in a timely fashion. And we found that some of the equipment that was being used was perhaps not the most optimal piece of equipment. And with parents, we found that what they really need is honesty and information, and to know what's going on with their child, and to be involved in the decision making around that treatment. And also they need practical support, like parking at the hospital, financial support because they can't go to work because they've got to be by the bedside of their child. The first study around the rates and incidence of childhood injury, we've been able to bring that to the attention of the federal government through a series of meetings with child commissioners and health ministers. And just 2 days ago, Minister Hunt signed off on the plan for a national injury prevention plan, because until then we didn't have one for this country, which just seems crazy given it's such a huge cause of death and disability. The second thing we've been able to do is change a piece of equipment that ambulance use, which has been a pretty great achievement, because we've got the third largest ambulance service in the world in New South Wales. And around the parents, we've been able to implement a family support coordinator. So that's one person that stays with that family from the beginning in the emergency department right through to up to 2 years post-discharge, helping coordinate their care, not having to retell your story over and over again, and someone that knows the system to help you along that journey. None of this is, research and translational research in particular is never done by one person. It's a brilliant team of people, and in particular Rebecca Mitchell and Kim Foster and Belinda Kennedy. And it also wouldn't have happened without funding, and the people that have been probably most helpful have been the Day of Difference Foundation, the Tyne Reid Foundation, NHMRC and New South Wales Agency for Clinical Innovation. But again, we wouldn't have been able to translate any of it unless we had partners like Ambulance New South Wales, National Trauma Registry, and I wouldn't have been able to do any of it if I didn't have the support of my wonderful husband and family.